We are role models. Our behaviour matters in front of young people. If you are having too much to drink, young people see that and that you're sending the message that it's okay. It's not really okay when you're under 18 and your body is developing, your brain is still developing. Sit down, have that chat with the young person and say, I did not have the knowledge in my day. It was the norm then. It's not the norm now. There's other ways to enjoy yourself.
Welcome to the HSE Talking Health and Wellbeing podcast. Today we're going to explore the important topics shaping the health and well-being of young people. In this episode, we're going to speak about alcohol and its impact on young people. We're going to be joined by Martina Byrne, who's manager of Crosscare in Ronanstown, and we're also delighted to be joined by Sive Brennan, who's in Leaving Cert. She's been a junior youth worker in the Clondalkin Drugs Task Force, and she's spoken on the topic of drugs and alcohol in a few different situations, and she's going to discuss that with us later. Welcome, Sive and Martina. So Martina, just talking about Crosscare, can you tell us a little bit about Crosscare and what you do there? What services you provide?
Hi, everybody. Yes, I work for Crosscare in Ronanstown, so it's in Dublin, Midwest. But we also don't only work out of Ronanstown, we work out of Quarryvale Community Youth Service, and we work out the Balgady, but also sometimes Lucan. So we provide UBU funded programmes, adventure sports programmes. We have an alternative learning programme for young people that are out of school and education. We have youth diversion programmes, school completion programmes. We also offer family support funded by the HSE. We do arts and music-based programmes, targeted youth groups, drop-ins, youth cafes, sports programmes, mental health and wellbeing, after-school groups, lunch groups, development education awareness programmes, drug awareness and alcohol prevention supports, and brief intervention and crisis-based supports.
Wow. And today, that's a lot of stuff that you provide.
It is.
And is it for your local community?
Yes.
Okay. And you work out of the Family Resource Centre?
We have our own service. We work in Ronanstown, just in the Neilstown Shopping Centre. But like I said, we have a satellite little centre. So we have a space in Quarryvale, we have a space in Balgady. But also we're very good at sharing and collaborating. So we work out of Lucan Youth Service as well.
So that's a huge amount of supports and services that you provide. And what we're here to talk today about really is about alcohol and the difficulty it is for young people to maybe talk about alcohol and to deal with alcohol from a young age. One of the things that we wanted to ask you, Martina, was why is delaying alcohol so important?
We have moved on from years ago where it was acceptable to kind of drink earlier. I think we never really realised the damage that was done to a young person's brain and a young person's health in relation to early alcohol. And now that we have that much more information, the brain develops in a young person well until their 20s. And it's definitely evidenced that early alcohol consumption really affects young people's health.
Yeah, so we have a lot of misconceptions, I think, about alcohol, don't we?
We
as
do,
parents?
indeed.
Yeah.
Yep.
And Sive, you've been through the whole Crosscare programme. Is that how you got involved in youth work?
Yeah, I started going at the youth club from when I was about 9 and I stopped when I turned 17. I worked on Thursdays and Fridays for about 3 years.
You worked with the programme?
With the programme. So
brilliant.
I did go to the youth cafes and I would help set up. I would help cook the dinners. I would run the music and stuff. So we did that. Me and one of my friends did that. And then we would just continue going on to the youth club. And then because I did all that with the youth club and then I did the course in TY with the drug task force, I was able to go do the 2 talks that I've done at Citizens Assembly and the Department of Health.
Okay, so tell us a little bit about those. That's really exciting for somebody of your age to have spoken at the Citizens Assembly and at the Department of Health.
Yeah, so when I was in TY, myself and my year were put into a module called the Drug Task Force with Martina and Mary. And I had known Martina before because I'd worked with her at the youth club, so it was easy to ease into it because I knew her already and she knew me along with one of the other lads. And after that module had ended, I was pulled and asked if I would speak at the Citizens Assembly with them. So I went. It was October. We were the last group to talk. And I was asked a couple of questions by Rory. And then I was asked by the public. And I answered them as best as I could. I was basically talking about how we should teach the effects of drugs at a young age, but not really young. And then I was talking about my experience with the course. And then at the Department of Health, I was there to talk about how we should continue bringing the courses and expand it to other schools. So I was called up in February of this year to go do that talk with Tara and Rory again. and I met ministers. I met the drug minister from England, Wales, Scotland, Ireland and Jersey.
Fantastic. Were you nervous going, or were you okay?
For the first one, I was quite nervous. After I had like gotten in and I was sat down and I was up on the stage at the Citizens Assembly, I kind of was like, okay, I'm fine now. And I was like, my family was at the back watching, and I was like, right, I'm okay. Because at least they were there for me, so I was happy.
They must have been so proud.
They were so happy.
Oh, brilliant.
And then when I went to go do the talk at the Department of Health, my dad was there with me and he was in the room. So it was really nice to have my family there. So it just gave me that bit of like, I don't need to be nervous because at least my family's there with me.
That's
so it was nice.
Sive. That's a really good lesson, I think, for young people. And it's really difficult for us to get young people to come and speak on topics that are important to them. So I really have to thank you at the outset for being here. So Martina, Sive mentioned the course, the Crosscare course, the drug and alcohol course that she did. Can you tell us just a little bit about that and how that works?
Yeah, so we're very lucky in the Dublin Midwest area that we are collaborate and are funded partly by the Clondalkin Drug and Alcohol Task Force. So we're part of a pilot project that's creating this prevention lab where holistically we have a whole wraparound service. So part of that is the education piece where staff go into schools, and we use evidence-based programs to support young people's awareness and development around the dangers of alcohol and drugs. Okay. And it's a 10 or 12-week program. So we don't advise anybody going in and do one-offs. This is a whole piece, evidence-based. And as you can see, the young people really buy into it. We build up relationships. We bust myths. We talk about exactly what's going on and the impact and long-term implications of early use of alcohol and drugs.
I'm sure they start to open up to you guys throughout the time.
I think that's one of the really good things. We're guard vetted to go in, so we get to go into the classes. There's a real honesty. We don't hide behind
and there's no judgment.
Questions. Absolutely no judgment.
Yeah.
We explain, we're mandated people. If there was anything we were concerned about, we would have to report it. But we give the young people the opportunity to speak honestly about what's going on for them in their lives.
Yeah. And Sive, what do you think is really going on for young people when it comes to alcohol and the age that they start drinking at and the peer pressure maybe, or even friends? Do they find it difficult?
I know people who like go to parties and stuff. Me and my friends aren't that type of friend group that go. We don't enjoy it. I'm not a big social person. I don't really like going out to parties and stuff. It's not my type of thing. And that's just always been the case. Even as a child, I just didn't really like going to parties and stuff. And even now, I still don't. I like to go out with the same group of people that I know. I don't like expanding and meeting new people. But I've seen through people in school and other places and stuff and my other friends, it's mostly just there's a house party. There's alcohol, people are drinking, people that are 18 are drinking, and they're kind of just giving people drinks. Like they're there, you can have some if you want. If you don't want it, there's other drinks you can have.
And do you think people much younger than that are drinking?
I would say, from what I've seen, 16 is like the earliest I've seen. I haven't seen anything under 16, but I kind of think drinking, you should be supervised. Like even with myself, I'm not like a big drinker. I don't see the need to be a big drinker. It's not something I would enjoy. I like sitting at home with my friends, maybe having one drink.
Yeah.
But that's it. Like I wouldn't go out to a pub and get drunk or something. I would just be at home. I like that. I like being at home, not out.
I've heard anecdotally that if young people aren't drinking, then very often they get left out of parties and they're not invited to parties in some occasions.
I think we're very lucky in that we have the youth service and we have an older one on a Friday evening, and it's geared towards enjoying life without the need for any substance, including alcohol or drugs. There's band nights, there's themed events, and we're actually inundated with young people coming to it. We've young people way up, like 20, 21, still coming. They get that opportunity. We have a creative section where they take part in bands and music, write their own songs. They can perform them. And I think there's not enough of those services out there, alternatives to alcohol or drugs, and we need more of them in our communities.
Yeah, and the service that you provide, are there services like this around the country?
There are, yeah. There's UBU funded centres around the country, but unfortunately down the country they wouldn't be as many as there are in the cities. But even still, we've vastly grown populations of young people across Luke and Clondalkin, and there isn't still enough services because of the demographics and the amount of young people that we have.
And do you think if there was more of these services that it would help prevent people?
I do. We've waiting lists for these services where young people want to be able to enjoy themselves without worrying, well, I'm not cool because I'm not out drinking on the streets, or I'm not doing something that I shouldn't be doing. These services are there. They feel safe. They feel protected. They feel included because it is their space. They're totally supervised, but they're supported. And if they need anything, there's trained staff there to help and assist, answer questions and just be there for them. But they feel like it is their space. They know every Friday, I can go up there at 8 o'clock till 11 o'clock at night. Parents know where they are, so they're not getting asked those awkward questions and they feel really safe.
Yeah. And when you talk about parents, Martina, how do you think parents can assist with this conversation with young people around alcohol and substance abuse?
I think to keep the lines of communication open, it's really important to give the right messages. Sometimes we're all guilty of saying, oh, I can't wait to go home and relax on a Friday night and have a glass of wine. You know, as an adult, maybe you shouldn't be saying that. Maybe you should be saying, you know, I can't wait to go home. Like, I've had a bad week, but not the reliance on alcohol or a substance to say, well, that's how I relax. Look at alternatives. Look at your own engagement with stuff like, are you within the healthy requirements of 11 for a week for a woman and 15 or 17 for a man? We're much more aware of the damage, even to ourselves, of what alcohol can do. And home measurements are home at lethal compared to what you get in a pub. It's too easy. It's too easy to sit down. If your expectation is don't do as I do, listen to me, it doesn't work. I think you need to make young people aware of the dangers, like the impact of going to school if you have a hangover, the impact of your concentration if you can't be in school and you're after indulging in something over the weekend. It has huge implications on your life chances and your goal attainments.
And of course, the brain development that you mentioned earlier
Absolutely, the brain development and the long term. Like, as I said, we know a lot more. The long term cancer. Alcohol is the one that moves across so many different things in our body. Those things that we didn't know before that we know now.
Yeah. And Sive, what age do you think parents should start opening up that conversation with young people around alcohol and substances?
Between the ages of 15 and 16 is like the perfect time to talk about it with them. Firstly, they'll be learning about it in school. That's the lessons that we learned when I was 15 and 16. Parents want to teach their kids, look, you're very close to turning 18. We want to build that trust that when you do turn 18, that we can trust you to go out. For example, I just turned 18 in July myself. And because over those couple of years that I've had that talk with my parents, I've done the drug task force thing, that I'm trusted to go out. Because I went out on Halloween and I was home by like 10 o'clock. I didn't stay out. My parents didn't have to worry about where I was. I walked into the house and my dad was like, I genuinely thought you were going to be out later. I didn't think you would be home by 10 o'clock. That is very early. Instead of me staying out till like 1 or 2 in the morning and coming home like drunk or something, I had like not even a full drink.
Yeah.
And I was able to build that trust with my parents to the point where they knew I was going to be safe because, one, I was with a group of people, they knew where I was, and if they needed me, they were able to reach me, or they were able to reach any of my friends I was with. So I think building a trust first, so then later on that your parents can trust you and you can trust your parents, that they're not constantly calling you to make sure you're okay.
Yeah, I think that's a really good tip. And when you did the course then, Sive, what other areas did you cover?
So at all the weeks we did it, I remember 3 lessons. I remember the very first lesson that we had, which was we were given a sheet of paper and we had to write down who were the most important people on the sheet. And at the very end, we were going through all the names and Martina had said to us, why didn't we put their name in the middle? Because the middle was who you thought were the most important, and it expanded because nobody put their name in the middle as them being the most important to themselves. So that was the first lesson we had. The second lesson that I remember was us talking about alcohol, where, funny enough, they got us to list all of the alcohols that we had known, and we mostly covered an entire whiteboard of all the different types that we had known. And then our third lesson was we were talking about the effects of drugs, which is the one that really stuck to me, because then I was able to use that for the other 2 talks that I had done, which was very useful. Yeah. And I didn't have to go looking back at one of my old notes from 5th year. So it was really good.
That's really good. And what advice would you give, Martina, to parents? I mean, I'm a parent myself, and sometimes I look back and I think, oh, did I do it right or did I not? And I know that there's evidence now to show that if we let children have a drink at home with us, that would be better. I did a podcast recently with Professor Bobby Smith, who said, no, we shouldn't be allowing because of the evidence. So can you tell us a little bit about that?
Well, unfortunately, like Planet Youth Survey in 2022, it clearly states parents really need to monitor their children. in relation to substance use, alcohol and drugs. But it can be very difficult, I know that, for parents. But we are role models. Our behaviour matters in front of young people. If you are having too much to drink, young people see that and that you're sending the message that it's okay. It's not really okay when you're under 18 and your body is developing, your brain is still developing, all of those things. Sit down, have that chat with the young person and say, I did not have the knowledge in my day. It was the norm then. It's not the norm now. There's other ways to enjoy yourself without alcohol. Maybe do more with your young person at the weekends, something that's fun, healthy and good for them. Even simple thing as cooking, rather than sitting down and having that glass of wine or that bottle of beer. Don't leave alcohol in the house if at all possible. A lot of young people that when we do these courses in the school say that their first taste of alcohol, would you believe, comes from the home. Maybe somebody thinks it's funny to put that glass in front of them and take that picture. It's an awful thing to say. I'd say a lot of us have those pictures, but we're building that mentality that it is okay to have alcohol when really it's not. We're not giving out to parents. We're saying, just think about the long-term consequences.
Yeah.
Look at our hospitals every weekend with young people. Violence, crime, hurt. People are getting hurt every weekend. Like, have those honest conversations where it's not good to start drinking alcohol early.
Yeah, so it's to delay it as long as possible.
Yeah.
And I think that whole idea that Sive mentioned about trust, for you to be able to trust your child and your child to be able to trust you, is so important, you know. And then when we talk about friends, Sive, do you think that peer pressure is a big influence when it comes to these things? I know that it sounds like your group of friends are very reliable and trustworthy, but for other young people, I think that it can be a difficult situation for them if everybody else is doing it.
I think peer pressure could be like a big factor on it, because if you're going into a house party and all like your friends are sitting on the couch and they're having a drink and you pick up like a can of Coke or something and they're all like, why are you not drinking? You should be drinking.
Yeah.
You kind of feel pressure being like, oh, maybe I should, because everybody else is drinking. I'm very lucky that me and my friends don't do that. Most of my friends are still under the age of 18. One of my friends, she has no interest in drinking. Even when she turns 18, she's like, I have no interest in it whatsoever. And one of my other friends, she's like, I just don't care. And even me, I'm like if anyone wants to go out for like a drink, I'd be like, I might go out for one, but then I'd be like, I want to go straight home. And then I'll have one and then I'll go home because I'm just like, I don't want to be here. And then I think it's peer pressure though, in some cases. But in other cases, sometimes they kind of just want to. Like their friends are doing it and they're like, oh, well, why not? Like, not like...
It's no big deal.
Yeah, it's no big deal. Like, they're all doing it, so I should do it as well.
Yeah.
Like...
And Martina, do you find that peer pressure is a big thing when you go into schools and you talk to young people? Do they say that peer pressure is a big thing?
Peer pressure is a big thing, and wanting to be cool and in the right gang, for want of a better word, being seen as one of the cool people, you know, oh, I did this at the weekend, or all my friends are doing it. And in most cases, all your friends are not doing it. You could get very easily sucked in. And part of the programme that we use is giving the young people the skills to be able to say no to peer pressure, how to cope like with anxiety, where that, oh, and I have to do something. And even with parents, knowing who your young people are with is very important. It is, like Sive said, about trust. So you know who those young people are with. You're aware of the friends group, maybe even, you know, the mother of the friends group.
Yeah.
And you all have that kind of collective agreement where it's not okay to engage in early alcohol use. And those things are really important.
Yeah. I have 4 children, and I'm not saying that I have a WhatsApp group with all the other mothers, but I do. And we all communicate that way. And so at 15 and 16, we've tried to figure out and know where everybody is at whatever time, and everybody's watching out for each other. You know, some kids aren't in that lucky situation that they have parents who are able to do that. And that's another situation. That's another talk for another podcast, because some kids are, like I say, don't have the support at home. But I suppose wherever parents can, just be aware. Don't think, oh, they're just 16 now, they're fine, let them off. You know, just really try and communicate with them and keep the conversations open. One of the other things that I wanted to ask you about was zero alcohol, Martina. Have you covered any of that in the course?
No, to be honest, we haven't. I don't think at the time it was within the 12 weeks, but it's become hugely apparent through social media advertisements and stuff like that, how much zero alcohol is creeping in. Like Sive was saying, young people at that age can fill a whole board with the names of alcohol. So that's how much of an impression those advertisements make. And now we have 0-0s all over the place, sponsoring sports events. Every time you put the screen up before the watershed they're on, it's crazy. You're on social media and the little ads are subliminally put in there where it's zero alcohol. They're promoting them, but like the risks are still there. That then, oh, it's okay. Now I know the name of an alcohol, and you're going into a supermarket. It might say 0-0, but the young people are very much aware of where it comes from.
Yeah, absolutely. It's the whole market employ, isn't it? And now everything it looks the same as every other type of alcohol. So it's a really good way of getting through the cracks, isn't it? And manoeuvring your way before the watershed and all of that. But I just wondered, is there evidence to say that young people are being introduced to 0-0, at an earlier age or not?
Definitely. Like even now we have an Unplug program. It's aimed at much younger people. It's not as in-depth, but it's evidence-based as well. And it comes from Europe. And those type of things are, at the end of the day, an alcohol company. It's a business. So they will do their utmost to create a market for themselves. And this 0-0 is creating another market and another way of introducing young people to alcohol. Okay, you can have 0-0 alcohol, but what young person is going to stand there with a 0-0 glass when the friends are going to drink one and say, here, come on. And like the temptation will be there to try something else because it's okay to have 0-0.
Yeah, and I think you've got the evidence on the street because you're dealing with the young people every day. And Sive, what do you think we need to do as a culture, as a society, to change this and to try and change the mindset of young people around the whole culture of alcohol?
We should try to explain to young kids that, look, this is here, this is the legal age. At that legal age, you can, but there is a point in time where you shouldn't, because obviously you don't want to go out every other weekend. That's going to do some damage or get liver damage and stuff. But if you teach them going maybe after you're 18, maybe once a month, every couple months, you could go out, you could have a couple drinks, not too many. I know people who, they are over the age of 18, they'll go out every other weekend and then they'll check their bank account and they're like, I actually have no money. I can't afford to.
That's another area that we haven't really discussed the cost of it.
I can't pay. She's like, I have a friend and she goes out every other weekend and she's like, she'll check her bank account. She's like, I can't pay rent this month because she goes out all the time. Now, thankfully, she's living with her parents, but she still has to pay rent. She'll go to her mum and go, I actually can't pay rent this week. I'll pay double next week. And then she'll go out and it just keeps building up, which is another issue, that it's just so expensive. And young people don't really make that much to be able to afford so much of it, which is also kind of really a good thing, that they don't make enough to afford loads of it at a time, but also not really a good thing because then they're not able to pay for the necessities that they actually need to pay for, and instead they're actually buying alcohol instead of paying rent or buying food or transport to school and stuff.
Yeah. And Martina, what do you think we could do as a society and as a culture?
I think every weekend, if you walk through certain parts of town, when did it become acceptable for people to become fallen down drunk? Where is society's responsibility to keep serving somebody alcohol when they're clearly really badly inebriated? I would love if we could say, you know what, like they do sometimes in some American states where they say, no, I'm simply not serving you. When is that going to be okay to say that we are personally responsible for providing and keep supplying this to young people? We're a society where you see every Friday, Saturday or Sunday night hospitals full of young people who've injured themselves through engaging in alcohol and drug use.
And there is such risky behaviour as well.
Risky behaviour, making the wrong choices for yourself, but endangering yourself.
Yeah.
We've won punches where people make fatal mistakes. That's not that young person, but through alcohol and changing their thinking, I think we could make a massive difference.
Yeah, and by people like you going into schools, discussing all of these issues with young people, do you think it would be better at an earlier age, or do you think TY is a good option?
Well, we have Unplugged. That's for first years, where we start with that programme. The Young People's Choice programme is the one that Sive done. So they're all sponsored. That's the PI, the Education, Prevention and Intervention. We don't just work with the young people, we work with the schools through Clondalkin Drug Task Force. We change policies in school to support parents being educated around the dangers of this. And I think we're very lucky that we have that wraparound service. Not all other areas wouldn't have that funding, but the hope is that they will eventually and use these programs. But I think it's really important that parents are aware and up to date of what is going on, because a few years ago it was all fruity alcohol ones. Things change for young people. Now we have like fish bowls where they're all drinking cocktails out of the one with straws and stuff. So you really need to be on top of the relevant and current information and the dangers. So parents definitely need to be informed.
Yeah. And Sive, what would you say to parents? What advice or what tips would you give to parents?
The first thing I would want to say is just trust your kids. Like, genuinely, just trust your kids. If you build up that trust, they might actually just say it to you. They're like, look, my friend's having a party. I'm going. There's going to be drinks. They'll probably say, I'm going to have one. They'll probably have more. But as long as you know where they are, when they're going to be there, how long they're going to be there, and who else is going to be there. I have most of my friends' parents' numbers and they have mine. And that's how we like it. So if something happens to me, they can contact them. Or if something happens to my friends, I can contact their parents, which is honestly, I think is perfect, which I think more people should do. More parents should get their children's friends' numbers. My two best friends both have my parents' numbers and I have both of their parents' numbers. Yeah. So if my friend's phone dies, her phone dies all the time, and her mom can't reach her, she'll text me and go, can you tell Mia to ring me please when her phone charges? Or she'll ring me and she'll tell me, give Mia the phone. And she'll tell her whatever she needs and then she'll hand me the phone back, or she'll just randomly text me, which is nice. But then that also helps you build a relationship with your friends' parents. Like, I love my best friend's mom. She's so nice. I love her to death. My best friend also loves my parents. Yeah. Like, they have a great relationship, which I think is perfect. I think kids should build a relationship with your friends' parents, but also the parents should try to build a relationship with your friends' parents.
You're an amazing role model for all young people, Sive. I think if we had you up there explaining things to people, things would be a lot easier. I mean, I've always said that to my kids, that, you know, no matter what, people are going to get into difficult situations as they go through life, but never be afraid of calling. There'll be no judgment. We might have to talk about it the next day or whatever, but always call. Never be afraid for them or their friends to call me. So I would concur with that, Sive, for sure. Maybe I've done something right. But Martina, what would your kind of finishing up advice be for parents in particular?
Definitely trust, relationships, communication. But I just love to remind parents just to remember, when you're thinking of giving a young person alcohol under 18, just think about the long-term damage to their health that it could do. We all want the very best for our children. We want them to do well in school. Yes, they will make mistakes, and that's very true. Having those lines of communication open are really important. Know that, okay, if I make a mistake, my parent will come and get me. My parent will support me. Okay, I might get like a half an hour of grief, but I can build that trust up again. Everybody makes mistakes. And just to remember that, like, communication, relationships and trust is really important. And it's a two-way street, especially when young people are trying to assert themselves as adults. And
absolutely.
Close your eyes and remember what you were like as a young person and the mistakes that you've made. But pat yourself on the back as a parent and say, I'm doing a good job, I'm trying. And that's really important, is that you try.
Yeah, I think that's really important, absolutely. And for people who want to find out more information about drugs and alcohol, we do have a helpline, 1-800-459-459, or you can email helpline@hse.ie. There is also regional and local drug and alcohol task force that you can find on hse.ie. So there is a lot of support and services out there for people and advice for parents on how to open up these conversations, how to talk to their kids. It just gives parents a lot of tips. Martina, thank you so much for coming in today. I really appreciate it. It's been invaluable, really, your information that you've given us and the advice you've given us in relation to young people and alcohol. And Sive, you're a star. I mean, I'll be following you from now on because I think we'll hear a lot more about you. Sive didn't mention she also just did an interview with The Guardian, advising The Guardian
to bring TY into the UK.
Bring TY into the UK. So she's a very she's an influencer. You're an influencer, Sive. So thank you very much to our listeners. If you think that this would be helpful for anybody that you know, for any of your friends or any parents, please share it. Remember, delaying alcohol isn't just about saying no, it's about creating a supportive environment and fostering open communication and developing that trust that Sive has mentioned throughout our podcast. Whether you're a parent looking to guide your teenager or a young person and you want to find out more information, go to hse.ie and you'll find lots of tips and tricks about opening the conversation around alcohol for young people. To all our listeners, thank you for your continued support, and please share this episode with friends or colleagues who may appreciate the advice and information. If you'd like more information about HSE Health and Wellbeing, follow us on X, LinkedIn, take a look at our HSE YouTube channel, or register for our Easing Today by emailing healthandwellbeing.communications@hse.ie. Thank you for listening.